Hello all, I'm Dr. Neema Bhat, Senior Consultant Hematologist, Hemato-Oncologist and Pediatric Oncologist. Today, I would like to talk about an interesting topic that's called leukemia in the elderly. So, the elderly population is usually considered adults who are above the age of 65, and these patients are at risk of developing leukemia, just like other patients, who can also develop blood cancer or leukemia. So, the symptoms of leukemia or blood cancer are similar in the elderly as it is in the younger population, which is mainly weight loss, fever, reduced appetite, enlarged lymph nodes, excessive bruising or petechiae, bleeding from gums, bleeding from the nose, bleeding in various parts of the body. So, these are usually the symptoms of leukemia. Leukemia presents with low hemoglobin or anemia, low platelet count, sometimes low WBC counts, and the presence of cancer cells that can be seen under the microscope in the blood. Leukemia in the elderly is mostly of three types. It can be either ALL, acute lymphoblastic leukemia, AML, acute myeloid leukemia, or chronic lymphocytic leukemia. So these are the most common types of leukemia in the elderly population, which is above the age of 65. So above the age of 65, patients or people become really frail and they're not able to tolerate treatment for the most part like younger people would be able to. This is a concern that concerns most family members of patients who are in the elderly population that are diagnosed with leukemia. But is there no treatment for it? I mean, should these patients not be treated? Should they just be left to succumb to the diagnosis of leukemia? Absolutely not. So leukemia in the elderly, even though it can be a serious diagnosis, it can definitely be controlled and an attempt could be made to give them a good quality of life with just few medications that are usually tolerated very well, and they're customized so that it doesn't hurt or injure their heart, their liver, their pancreas, their kidneys, and various other organs. Also, it should not drop their counts too low, which is it should not make them too anemic, should not cause them to have very low platelet counts, should not put them at a higher risk for infections because it will be difficult for these patients to tolerate it. So these days, as of the last 10 to 15 years, we've seen the development of a lot of medications called targeted therapy or medicines that specifically target the genetic mutation that are the triggers. So these are medications that are called targeted therapy, which is they specifically target the mutations that are the triggers for these leukemias or blood cancers. So targeted therapy, the advantage of targeted therapy over conventional chemotherapy or medications that is called chemotherapy is they don't reduce the counts of the patient a lot. They are not very toxic to organs like heart, liver, kidneys, and lungs. They're well tolerated in the form of just tablets. They don't require to be taken as IV infusions or injections. Hence, they reduce the patient's visit to the hospital, multiple times. And it can be continued for a long period of time. So if somebody is required to come to the hospital to take, injection 3 days or 5 days of a month, or sometimes even once every 3 weeks, their likelihood of continuing the treatment for a long period of time is much lesser, as opposed to if we ask them to take a tablet, say, once a day or even 2 times a day and just get blood tests done on a regular basis to monitor and control the spread or advancement of leukemia. So do not fear about a diagnosis of leukemia in the elderly patients above the age of 65. Do not hesitate to get it diagnosed and get treatment started at the earliest possible, because leukemia, even in the elderly patients, can be managed and we are able to give them a good quality of life with a prolonged living. If you have any questions about leukemia in the elderly, please feel free to reach out to me. I'm Dr. Neema Bhat, Senior Consultant Hematologist, Hemato-Oncologist, and Pediatric Oncologist. Right.